So now we're going to come down into a couple of stretches, and we're really going to focus on lumbar spine and hips as well. These are areas that do get a lot of stiffness, tightness, maybe aches and pains because we spend a lot of time in the seated posture. And muscles that do tend to stay in static positions for long periods of time can become not shorter, but slightly stiffer. Okay, the concept of muscles actually becoming shorter is a bit of a misnomer. Muscles have a resting length or a resting tension, and we can increase that through coaching the flexibility or mobility of a joint. So what we're going to do is just try and increase the range of motion slightly around the back and the hips. So from here we'll go down nice and slowly into a lying position, and then from here we take the opposite knee to the opposite hand, or the opposite hand over the opposite knee, and take the knee across the body and look the opposite way, keeping the shoulder blades down on the floor. And then from here you can inhale, and as you exhale you can go further into that stretch as the body naturally relaxes on the exhale. Okay, and again inhale, and as you exhale just allow the opposite knee to come closer to the ground. And then you can bring both heels in towards the bottom, and keeping the shoulder blades down and relaxed. You can go into what I call a knee pendulum, where the knees swing one way, keeping the knees together, inhaling to the middle and exhaling to the other side. And again, you can get a full spinal twist by looking in the opposite direction that the knees are turning. So there's a twist coming from the base of the skull down to the top of the pelvis. Okay, great stretch or opener for the hip joints is named the 90-90 stretch. 90 as in 90 degrees, and 90 degrees in the back knee as well. So ensure that you're sitting on one of your buttocks or one side of your hips, sitting as upright as possible. Some of you will be able to really sit up if you've got more flexibility. I'm not particularly flexible. However, you can support yourself with your opposite hand. You breathe in, and in this position just aim your sternum or the middle of your chest over the front knee, and you'll feel that stretch right at the back of the hip. So gluteals there. Glute max, glute med, and glute min. Good. Breathing out, inhaling, coming back, and then changing your angle and going to another area of the hip. And every time you change the angle of your torso, you'll get a different area of the back of the hip. Using that breath, as I said, to breathe, to relax into the stretch by breathing out as you go in and coming out slowly. And then from here we can hit the back hip. So here we've got a hip flexor at the front of the hip. This is about the back of the hip. Here we've got the front of the hip, okay, the psoas muscle hip flexor. And what we can do here is we can take one hand over and reach away. And for some of you, you won't get that stretch, but for those with tighter hips, you will feel a stretch coming down the quad or the thigh into the hip flexor. Coming round and back. And again, round, using that exhale and coming back. And then from here, we can just smoothly transition onto the other side, 90 degrees, chest over the knee, exhaling as you drop in, inhaling out, and then changing angles as you go. Okay, so in a single kneeling position, we can really start to focus on the front of the hip. And as I mentioned earlier, when we're sitting, often muscles, their resting length can become slightly shorter. And hip flexors are a common muscle that do tend to get a little bit tight after long periods of sitting. It can only take a matter of hours before muscles actually adapt to a position that they're in. So, it does stand to reason that the hip flexor at the front of the hip can be problematic at times. And because it attaches into the lower back, a tight hip flexor can obviously cause lower back discomfort. So from here, all we're going to do is we're going to lean forward at the hip until we get a stretch at the front. Okay? And what we're looking to do here is not lean forward in the chest, but thrust the hip forward so we get a stretch in the hip flexor. And if we want to increase that, we pull the navel in, and that really does bring a bit more of a stretch to that psoas muscle. And if we want to increase it further, we take the hand over and we get the stretch actually down the side of the abdominal wall as well as the hip flexor. Okay, so inhaling, exhaling. Inhaling and exhaling. And turning away slightly again increases that slight pull on the psoas, because it's also responsible for rotation as well as hip flexion and extension. Hip flexion, sorry. From this position, we can then take this into a hamstring stretch. So from here, we can just take the front foot out slightly and then rock back onto that back knee and lean forward. So we inhale as we come up, and now we exhale as we lean forward, taking our nose to our front toe. It's okay to have the knee slightly bent, and we shouldn't be trying to increase the stretch until discomfort. The stretch should actually be manageable with a definite sensation, but not to the point where you couldn't really go any further. Just a nice gentle mobilization, and each time you come forward from the hip, you may be able to just get a little bit more range as the hamstring starts to warm and the nervous system starts to calm and allow you to take that stretch. So again, breathing out, leaning forward from the hip with a slight bent knee, taking the toe to the nose and just holding it for a split second. A great stretch for the hamstring. So in the kneeling position, we can really focus on getting a stretch down the thigh and also down the front of the shin. So from here, you can just sit back onto your heels, and instantly there you should get a really nice stretch at the front and top of the ankle, and you can just move the hips side to side. For some of you that will be very easy, for some it may be a little bit uncomfortable, so just keep coming in and out of that little mobilization slash stretch. Remember, we're not staying static in the stretches, we're always trying to move in and out and allow the muscles just to adapt to that new range. From here, if this is comfortable, you can put one hand or two hands behind you, and from here draw the navel in, and as you do that, simply push your bottom away from your heels and just feel that stretch coming all the way from the hip flexor down the front of the thigh. Again, sitting back onto the heels, drawing the navel in, exhaling as you push your hips up to the ceiling, and you'll also get a lovely stretch through the chest. Inhaling and exhaling, reaching away. Good.